Namaste. I am Dr. Shantakumari, Chief Physician and Managing Director of Mada Ayurveda Eye Hospitals, Thiruvananthapuram. Now I am trying to discuss something about dry eyes. Dry eye means the patient may be feeling dryness in his eyes. And what is dryness? We know the eyeball is moistened and kept wet because of the tear secretion that is flowing continuously over the eyeball. And when this secretion or tear is not sufficient enough to lubricate the surface of the eyeball, the patient feels dryness. Now the reason behind this is many. But among these different causes, two factors are more important. One is inadequate production of the secretion. That is, the tear glands are not producing enough quantity. And this may be due to different reasons. Maybe the glands may be underdeveloped or maldeveloped, or some disease of these glands, and some duct problems, and so the secretion is not drained out, and these are due to the gland problems. The second group is this reason. Second main reason is the under quality of tear secretion. And there is enough quantity is there, but quality is less. Now we have to think what is the normal or apt quality of this tear secretion. Generally speaking, we can say that there are three layers of this tear secretion. It is a fluid continuously flowing over the eyeball, but it is in three layers. The outermost or topmost layer is having fatty acids, mainly content is fatty acids. And these fatty acids are not produced from the tear secretion, but it is produced by the glands of the eyelid, especially meibomian glands. And the function of this layer is to make the corneal surface smooth and clean, and to prevent the evaporation of the fluid. Since it is a fatty layer, it prevents the evaporation. So the tear secretion is kept as such, or kept in long time on the corneal surface of the eyeball. The second layer is the actual watery layer, and it contains mainly water and electrolytes, and also some growth factors also are there. This layer is mainly keeping the moistening of the eyeball. And the eyes are exposed, open to the external atmosphere, so evaporation is very, very high. So that much water should be there. All these are maintained by the second layer. And the third layer is actually a mucus layer. And the function of this layer is to maintain the corneal surface clean. And if there is any deficiency of this layer, or the contents of this mucus layer, there will be patches, dry patches on the corneal surface. So chances of getting infection is very, very high. From this, we can understand the characteristic nature of the dry eye. In the first reason is underdevelopment of the production of the tear secretion, that the overall quantity will be less, so the patient will be feeling more dryness. He can't expose to the bright light and the there will be burning sensation and also high level of dryness feeling. It will be more when while traveling or while working on computer, etc. That will be the main symptom if the quantity of tear secretion is low. And this another group, second group, when the fatty layer of the tears fluid is less, insufficient, the patient will be feeling dryness in another way. That is, evaporation is more. So she will be longing for always to keep on watering his eyes. He'll be trying to wash his face every now and then. And if the water content is less, that means insufficient second layer of the tear fluid, the fluid will be more or less dense and there will be stringy secretions in the eye, especially in the morning. That means the water will be less and so the fluid will be thick in nature and always string-like deposits or secretions will be there. And in the third group, when the mucus layer is less, corneal damage will be very easy and it will be common and so infections will be more. So from analyzing or the analysis of these symptoms is very, very important. And now coming to the treatment section. From this description itself, it is clear that a single drop or a single medicine is enough for all dry eye patients. It is not like that. We can see that different types of reasons are there, different symptoms are there. So the treatment also will be varying. Again, we can say that this production or this maldevelopment of the secretion is can be seen in association with some other disease, even by diabetic mellitus or due to a complication of radiation therapy or sometimes autoimmune diseases. Like that it goes, a number of causes there. So a differential diagnosis is absolutely necessary. Don't think that dry eye as such is a disease and a one drop or one treatment is enough for all patients at all times. According to Ayurveda, we are analyzing the symptoms seriously and in a scientific way and is finding out the underlying cause. And on that basis, treatment is charted out. If the reason is maldevelopment of the glands or the production is less, the treatment will be one group. We have to nourish the glands or we have to give medicines internally in a large, in a high level and make it, try to bring it normal to its size. Then the other groups, when there is fatty acid deficiency, there are oilation of the system is very necessary. There are different types of methods for that. Shirovasti, that even extraocular treatments are very, very necessary. For that, the Shirovasti or Shiroabhyanga, like that, very scientific treatments are there. Even nasal drops are highly effective. But the medicine should be very selective and that will work on the ophthalmic system. And if there is tendency of infections, that means the mucus layer is more insufficient and corneal layer is damaged, the treatment is still different. Some treatments for healing purpose and also to maintain the corneal surface also is necessary. For that, pure external ophthalmic medications are very, very effective. For that also there are highly modified treatment procedures in Ayurveda. That is Netra Tarpanam, Netra Podapagam, etc. are only examples. So in short, I want to again insist the point that the treatment of dry eye is different in different people. We have to analyze the symptoms and find out the root cause and select the medicine accordingly. So then we can protect your eyes from being dry and affecting the vision. Okay, thank you. This Points are shared with you by Dr. Shantakumari, Chief Physician of Mata Ayurveda Eye Hospitals, Tiruvallur.